How embarrassing for you when you are holding a cup of coffee which is hot, when your hand is shaking. Why Parkinson disease people have tremor and how does it affect their functional skills and how can we help them? Hi, my name is Ganapati. I am the head of the occupational therapy department and an advanced neuro rehab specialist at PRS Neurosciences. In Parkinson disease, the tremor can happen because of a mechanism which the brain controls the movement. So, when we are producing a movement, the movement is a voluntary movement, your brain is telling you move in this direction. At the same time, your brain should also have a control, means modulate the movement, make sure it is not shaking in this direction I want to move. You want to know what are the reasons why Parkinson's disease have tremor and what are the different types of tremor. Please look at this link, watch our previous video. The Parkinson patients can have three different types of tremor. I can tell you briefly. One is the resting tremor. When their hand is at rest, it will be keep shaking. And the second thing is called actional tremor. When you are trying to do something, it will shake. The third type is postural tremor. That is when you are being in one sustained posture or you are holding something, it will be shaking. So, when someone is having tremor, it can affect their functions in different ways. For example, if someone is brushing, if a person is brushing, you need a smooth rhythmic movement to brush. So, if you have a tremor, it can create an abnormal shaking movements which can cause injury to the gum or shaving or finer makeup tools when you are using a finer makeup tools or buttoning or holding a hot cup of coffee or you are cutting vegetables. These all can be a dangerous activity when you have an abnormal tremor which you are not able to control it. And also which will create a lots of embarrassment and anxiety in the patient because they don't know how to control the tremor. When people are watching, it can increase. This can affect their quality of life significantly. So, when we want to assess the tremor, like in our center, what we use is we use a concept called SARIs, which will assess a different segments of tremor like speed, rhythm, accuracy and different multiple aspects. We call it SARIs concept, and also we have a concept called MAS. It is like movement, action to skill. We assess that, and we have an assessment tool which will measure their functional aspect of their hand, also the finer aspect, and we level them according to their functionality. Once that is done, if we look at it, how can we manage it? The first thing is the medical management, the pharmacological management which can help to reduce the tremor or keep the tremor under control when you are performing the actions. You can watch this link to understand about the pharmacological treatment procedures, that means medical treatment procedures. There are some surgery options which can help the Parkinson patients to reduce the tremor, hand tremor. So, you can wait for our upcoming videos which will give some clarity on the hope the Parkinson patients have through surgeries. Also, we have rehab procedures. After the complete detailed assessment, we do rehabilitation based on a neurological recovery or restorative approach, that is to improve the muscle control and reduce the tremor through various exercises and activities and repeated motor learning practices. Also, we have compensatory strategies where you can modify the task or you can modify the utensils or the tools which they are using. Some of the examples I can give you. For example, somebody is having problems in handling the nail cutter. It's very fine, and if they are not able to handle it like while cutting, they have shaking. That we have tools to modify it and make it a little more little more better and little more control will be there when they are using it. So, such devices will help to increase the control while they are moving it. They can use their proximal joints to control the movements. Also, we have devices like build up handle for pen, like especially when they have a smaller writing, they have a better control with the modified grips on the pen. Also, we have devices like modified spoons, like especially when they are handling spoon, they have to use a finer grasp, like pinch grasp. So, this is one of the biggest challenging when they are handling the spoon, that can shake and cause frustrations. So, what we do is, like, we create build up handles, or we add weight over this object, which can help to get a better control over the grasp. Also, we can have glass holders, like you can keep the glass, that they don't have to hold it with with this kind of grasp. They can hold it in a more stable grasp, and they can control these things. So, such options are available. With a detailed evaluation, our therapist will suggest what is the best option suitable for that particular patient. If you know somebody who is having such problems like tremor and slowness of movement, contact this number, which may be helpful. Thank you so much.